Anulom Vilom, mental. Anulom Vilom is also called as alternate nostril breathing because we are alternatively breathing from the nostrils. Okay. In this, what we do is we will not be using our thumb and index finger like we normally do in alternate nostril breathing. We shall try to do it mentally. So we will inhale from, let's say, the left nostril, exhale from the right, then inhale from the right, exhale from the left, inhale from the left, and continue. Now, you cannot do this perfectly well, but you can make it so that the air is going from your left nostril, from the outer walls, from the inside, but outside. Okay, and when you exhale, it's coming from like kind of curved like that. Okay, so let's try to do this. There's no way you're going to tell I'm doing it, but let's just do it a few times. And when you exhale, slowly release. So, it's, one might ask, how do I do this? So it's just like this, some people, you can focus on the muscle in your ear and you can lift the ear. You can focus on the muscle of your eye and lift one eyebrow, right? Same way you can focus on the muscles of your nose and basically inhale from that nostril. Focus on the muscles of your right nostril and exhale from there. Focus on the muscles of the right nostril and inhale from there. And with practice, you'll be able to do Anulom Vilom mentally. And Anulom Vilom is a very beneficial breathing exercise because it helps to focus and balance our mind. When the mind is well balanced, it relaxes our body, and the body heals when it is relaxed. Marjarasana, very gentle flow. This is the cow to cat flow. Get into Marjarasana, hands are directly underneath the shoulders, fingers are wide apart to take away pressure from the wrists. Knees are slightly apart. Inhale, bend your spine down and look forward. And make it so that the base of your head is touching the neck. If you have cervical spinal injuries, just look straight. Okay, as you exhale, tuck your chin in towards the chest, arch your back up high and tuck your tailbone in. Let's repeat this 5 to 10 times. Inhale, looking forward, stick the tailbone and buttocks up. Exhale, and once again, tuck your chin and tailbone in. Back forms a nice arch. Continue. Be aware of your breathing and the stretch in your spine and the back muscles. This flow stimulates our spine. Breathe in, breathe out. And now slowly release and relax in tabletop position. Or you may slide your body into Malasana or child pose and completely relax. If you'd like, you may keep your knees wide apart. So raise your body, place your knees wide apart, and then go into Malasana. This will further give you a better stretch in the back muscles. Setu Bandha Asana. Setu means bridge in Sanskrit. Bandha means to hold or tighten. One should avoid this posture in case of severe neck or back pain. Begin by lying flat on the mat. Bend both the knees. Raise the hip area and place your elbows on the floor and hands underneath the waist. Now, while keeping the hips raised, try to straighten the legs. Rest the shoulders and the head on the ground. Remain in this position for 10 to 20 breaths. This posture strengthens our spine, leg muscles. It also stretches the abdominal organs. Breathe in, breathe out. Observe as you inhale, the lungs fill up, belly rises, ribcage expands slightly. As you exhale, the lungs empty, belly goes in, and the ribcage contracts back. This posture also increases the blood circulation in the upper body.
We are energizing our thyroid gland in this posture. Now to release, gently bring the hips back on the floor and the legs. Slowly stretch your arms. Let go of all your weight onto the floor and completely relax. Setu. Setu means bridge in Sanskrit. One should avoid this posture in case of neck injury and recent knee injury. Begin by lying flat on the mat. Bend the knees, placing your feet flat on the floor and position them a few inches apart. The feet should be directly underneath the knees and your knees should not be jutting out. The lower legs should be perpendicular to the floor. So pressing your feet and arms into the mat, raise your hips as you inhale. Interlace your fingers and stretch out your arms. Maneuver your shoulders and come up even higher if you can. Let's stay in this position for 10 to 20 ujjayis or ocean breaths. Now let me talk about a little bit of the flaw that can happen with the knees. So if your feet are very close to the hips, so if you can, Alexa, walk your feet towards your hips and then lift your hips off the ground, you notice how the knees are jutting out. We don't want that happening. So you want to come back down. Make sure your feet are directly underneath the knees. The feet are slightly apart. Okay, and the inner thighs are parallel, inner feet are parallel. Lift the hips off the ground, interlace the fingers, stretch your arms out and maintain this position. Enjoy the stretch in the back muscles and leg muscles. This posture increases the blood circulation in your upper body, energizes the thyroid and opens up the chest, giving you lungs more room to expand and thereby facilitate breathing. This is a wonderful pose to observe your diaphragmatic breathing. Observe as you inhale, your belly rises. As you exhale, the belly comes back down. This posture gives instant relief for people that are experiencing lower back pain or sciatica pain. To release, come out of the posture. Bring the hips on the ground, stretch your legs out, release your arms and completely relax. Dhanurasana or Urdhya Chakrasana. In Sanskrit, Dhanur means bow. This posture is also known as Urdhya Chakrasana or upward wheel pose. The bow pose should be avoided with lumbar or sacral back injury as well as shoulder problems. Perform carefully with knee injuries. We'll begin bow pose by lying on the mat and place your chin on the mat. Bend both the knees and stretch your arms backwards to grasp each ankle or the feet. Rest here a moment and exhale completely. On inhalation, pull your legs upwards and raise the upper body off the mat. Lift your head up. Raise yourself as high as possible as per your comfort level. Bring the knees closer to increase the stretch in the spine. Be mindful of your diaphragmatic breathing. You will notice your body rise off the mat slightly with each inhalation. Enjoy bow pose for 10 to 20 breaths. This pose stretches the neck, back, the thighs, and stimulates the spine. It expands the shoulders and chest to improve lung capacity. It also helps to tone the abdominal muscles. Be aware of your breathing. Continue to inhale and exhale. Face is relaxed. Now slowly release the pose by releasing your ankles and gently lowering your arms and legs to the mat. Return your head to the mat and relax. Bhujangasana. Let's begin by placing the chin on the floor and place your hands by the side, thumbs by the nipples. Okay, now slowly as you inhale, come up. Now let's go back down for a second and put the elbows tucked in and now come up as you inhale. Very nice.
Okay, and make sure that your elbows, inside of the elbows is facing outside. Excellent. Now enjoy the stretch in the back muscles. If you're okay, like if you don't have any cervical spinal injuries, you may lean and take your head backwards. Very nice, such that the base of the head is touching the neck. Breathe in, breathe out. Your legs, your buttocks are completely relaxed. Maintain this for 10 to 20 breaths. And observe how you're energizing your thyroid, parathyroid, pineal, pituitary, pancreas, and the liver. You're flexing the spine. Breathe in, breathe out. And now to release, slowly bring your head forward, bending your elbows, gently come forward. Stretch your arms back by the side of the body. Turn your head to one side and completely relax. Matsayasana. Matsya means fish in Sanskrit. Avoid this posture in case of neck or spinal injury. This is an advanced posture, so please proceed with precaution. And one can only do this posture if they can sit in Padmasana or lotus pose. Let's begin in Padmasana or lotus posture. As you inhale, lean back and place the top of the head to rest on the floor. You may place your hands on your thighs and gently grab onto your big toes with your hands. Maintain this for 10 to 20 breaths. In this position, we are stretching our back, shoulders, chest, and neck. We are flexing our spine, energizing our thyroid, liver, pancreas, and other vital organs in the abdominal and thoracic cavity. Notice how the chest is expanded, giving the lungs room to open up freely. It is said that if you stay in this posture, you can actually float in water. Be aware of your breathing and the stretch in the neck muscles. As you exhale, slowly release your arms. Gently place the back of the head on the floor. Stretch your legs out. Turn your body to one side. Stay on the side for a few breaths. And gently come into a sitting position. And relax in Dhanurasana. Malasana, garland pose walk. Avoid Malasana or garland pose if you have had knee surgery or are experiencing severe knee pain. Sit in a squatting position with your feet wide apart. Try to bring your heels on the floor. If it is difficult, just keep them raised. Make a namaste with your hands and now walk. Do this for about a minute or as per your capacity. In this posture, we are compressing and energizing our digestive organs, strengthening the leg muscles, and strengthening our knee joints. Slowly walk back to your mat. Come back to the starting position. Release your arms, legs, and come into seated positions. If you like, you can even stretch your legs out. And sit in Dhanurasana and relax.
Viparit gardening. Viparit means opposite in Sanskrit. This is the inverted pose. Please avoid this posture if you have high blood pressure, glaucoma, or are menstruating. Let's begin by first stretching both the legs. Gently raise the legs through 45 degrees, 90, and then extend the feet beyond the head until the legs are parallel to the floor. Support your hips with your hands. The elbows should be shoulder width apart. Raise the legs vertically in the air. Make sure that you maintain about a 45-degree angle between the legs and your torso. So bring your legs slightly lower. Because if you keep your legs perpendicular to the floor, there is excessive weight on the elbows. Maintain this for 30 to 60 breaths. This posture increases blood circulation in the upper body, relieves varicose veins, energizes the thyroid and parathyroid glands, releases pressure in the groin and lower abdominal region, keeps the uterus in a healthy condition, and prevents displacement of abdominal organs and hernia. Improves functions of the gonad and adrenal glands. Adds glow to the face and clears out facial acne and pimples. To release, slowly take the legs over the head parallel to the floor. With full control, gently bring the hips on the floor and release the legs. Straighten your legs out and relax. We shall now do 2 counter poses. One is the half fish. Slowly place your hands underneath your hips or the sacral region. Using your elbows, bring the top of the head onto the floor and uncurl the neck. Stay here for about 5 breaths. Breathe in, breathe out. Slowly release. Release your arms, relax. And we shall do the threading the needle. Bend one knee, place the other foot. Take the arm in between and hold on to the outside of the knee. Bring the knee close to the floor. When you do Viprit Karni, what happens is there's an arch in the middle back that's formed. And when you do this complementary posture, you're trying to flatten that part of the back. Breathe in, breathe out. Slowly release. Let's go to the other side. Squeeze the knees close to the chest. Enjoy the stretch in the outer thighs. Be aware of the flattening of your middle back. Breathe in, breathe out. And now slowly release, stretch your legs out. And finally you can do the neck out stretch lying down. So inhale, turn your head to one side. Exhale, bring the head back to the center. Inhale, turn your head to the other side. Exhale to the center. Do this a couple more times. And slowly come back to the center position.
Shavasana. Let's begin by lying on the floor. Feet are 10 to 18 inches apart. Palms facing the sky, fingers gently curled. Find a comfortable position for your head. Let's begin this mental relaxation, starting with the legs. Relax the feet, the lower legs, knee joints, thighs. Relax your hip joints, pelvis, abdominal muscles, chest muscles. Relax the shoulders and relax each and every vertebrae of yours. Relax the buttocks. Let's bring our awareness to the arms and send a wave of relaxation through all the muscles in both your arms. Relax your neck muscles, facial muscles, your eyes, eyelids, eyebrows. Bring your awareness to the head and relax the entire skull region. And observe your breathing, the smooth and steady breathing. If there is any part in your body that needs that extra relaxation, you may relax it now. Otherwise, stay focused on your breathing. To release, slowly wriggle your fingers and your toes. Gently turn on to your left side or your right side. Place your hand underneath the head, making a pillow out of it, and slowly come into a sitting position. Let's rub our palms, make them nice and warm. Place them on the eyes. Let the warmth flow from the palms to the eyes. Release the hands. Place them on the knees. Open your eyes.